Hello, everyone, and welcome to the fourth webinar in the series at Fall 2021 Social Entrepreneurship for Innovation in Health course. As you know from the course overview, Module 4 and 5 are about co-creation. So these two modules will allow all of you to review real-world and potential co-creation projects spearheaded by health innovators. This week's module talks about co-creation with focus on leveraging shared value. But before we jump into the session, please don't forget to take the survey that you see below the screen. By now, all of you know that you get extra credit points to watch us live. Also, please do drop your question for our guest expert for today so that we can address them during the span of the session. And now, without much ado, I'm delighted to welcome Dr. Daphne Ngunjiri, who is our guest expert for today and CEO of AccessAfrika. AccessAfrica's mission is to provide affordable and quality healthcare to people in informal settlements in Kenya. Daphne is a doctor and brings with her 11 broad years of experience in healthcare as a practitioner and management professional. Her academic qualification includes Bachelor's of Medicine and Surgery and MBA in Healthcare Management and Policy. She is passionate about healthcare system, data and analytics as tools to drive operational efficiency and clinical quality in healthcare. Daphne, welcome to the session today and thank you for joining us.
Hi, Indrani. Thank you for the introduction. Glad to be here today.
Thank you, Daphne. Daphne, you are a doctor and a management professional. You're committed to creating access and systems to benefit people at large. Could you share briefly about your professional journey and how you became part of AccessAfrica's leadership team?
Yes, I'd love to. Thanks. I'm trained as a medical doctor, trained here at the University of Nairobi in Kenya. And, after that, really just started my clinical career working in rural Kenya. So 6 hours, about 6 hours outside of the city, in a kind of a mid-level hospital. It was the first time that hospital had doctors posted to it. So it was a new center for doctors to spend their kind of first clinical years there. And so it was a really enlightening and eye-opening experience for me in public sector. I spent about 5 years there, had a world of experience just clinically, but also just experiencing the healthcare system as it exists for, Kenyans in general. And found myself, off the journey. I was particularly interested in surgery, and that's the specialty I was working towards. But after spending time on the ground, realizing that there are inadequacies in the healthcare system, I decided to take on an MBA first. And it was through that I actually then started to surround myself and work with people who were already starting to solve this problem of reliable quality healthcare for the mass market. And so spent some time in digital health, quality management in primary care. And that's how I started to work with AccessAfrika. And became really enthralled by the vision and mission of the organization. This was at the time AccessAfrika, a single clinic in an informal settlement in Nairobi, and it was focusing on all the right things that I felt were really missing in my time in public sector and in private sector, and so found a huge alignment in the work that AccessAfrika was setting out to do. So joined the team then as medical director, and then as managing director, and currently serving as the CEO.
Wow, that was quite a journey. Daphne, could you also tell us a little bit about AccessAfrika? Yes, we did post a link, so most of our learners may have gone and visited the website. But can you tell us a little bit about AccessAfrika as an organization, its healthcare in a box model, and also a little bit about AccessAfrica's growth journey? I know that you want to share a presentation, so feel free to do that whenever you want during your response.
Right. Yeah, I'll just go ahead and share my screen now. So Axosafia is a social health enterprise. And what we have designed is an available, affordable, and quality healthcare scalable franchise system that couples digital and physical clinics. So we operate our physical clinics under the brand Curafa, which are a franchise chain of clinics, and our virtual clinic under the brand Mdaktari. And so this couples and allows continuity in healthcare, not just in physical clinic, but we know that healthcare doesn't start and stop in the clinic, and our tech enables us to do this. So our clinics are located within 15 minutes of walking distance from the people that we serve. An average cost of care costs $3 to $5 for a visit. Average wait time at our clinics is 33 minutes, and this is compared to the large wait times that one might experience in other alternatives. And the reason that this is important is because of the lot of people that we serve are informal wage earners, and so therefore any time spent away from their businesses is income lost, either the businesses or in the factories that they work. So it's income loss. And we focus on key quality metrics, like the stock availability, and maintain 99% stock availability. Our virtual clinic is available as a progressive web app and also on the Safaricom M-Pesa a super app. It costs $3 for a visit, and this also allows us to serve people who are not just in our market. So it builds resilience in our model in that it's location agnostic, right? So we don't need to, it serves people directly in our catchment area, but it also serves higher income groups. So it has an additional revenue stream benefit to AccessAfrika. So in summary, in terms of how this coupling of brick and mortar and digital works is, a patient might hear about us, taking a blood pressure screening in the community with a community health worker, or increasingly they might screen themselves on our virtual tools. Right. And that kind of gives them the first access point, gives us an indication of, whether you need to seek care or not. And so this is our first kind of triage step in putting people in care. It serves the purpose of awareness beyond also just screening, because there is, kind of a huge barriers to seeking care because of awareness of whether this is something I should seek care for or not. And once they visit their clinic, they can get a diagnostic test, their medications. After the visit, we follow up with all our patients to find out how they're doing. If they're not doing well, they can reach out back to their doctor conveniently on Mdaktari from their business location without leaving, their work. And the doctor, has the information that they need to take specific actions for the patient. So I have this, not just a segment, but I have this individual patient who has, missed an appointment or has missed several appointments, or their blood pressure is not controlled. They can take very specific actions on a group or an individual level. And so that's the, kind of the summary of our solution today. What is really, behind that in the how? And one of the questions we get is how are you able to deliver care at an average of $4 a visit? Is one, through standardization. So a high degree of standardization that not just ensures quality, but is really what we've been building and iterating on over the last 8 years, is what is this nexus of cost, quality, and access that will drive affordability and scalability. So this is what we have standardized, from the square footage of the clinic to the scope of services provided to the pricing, the team size as well. So literally even the workflow in the clinic is kind of redesigned and optimized. And so we standardize this, and then we use technology, and this is a combination of custom and off-the-shelf technology, and we use this to improve efficiency in the clinic, to provide the data for service and business improvement. And then we take this model, we train a franchisee on how to deliver it, and it's grown through a network of clinical officers or nurses in their local communities. So this is essentially what we provide the franchisees. So they have a fixed menu of services that we provide. And this menu of services is designed to cover the scope of primary healthcare. So covering outpatient needs, telemedicine and pharmacy services. It's actually also through this innovative approach, value added, I would say. So a typical primary healthcare clinic in Kenya under level 2 kind of status is what where we fall for primary healthcare, might not have the full scope of this. So I call it value added because, for example, we do ultrasound. Well, ultrasound would be considered a level 3 service, but, through partnerships, which I'll speak about more later, we're able to increasingly provide access to services that are not typically available at that level. Another example, obviously, is telemedicine services. And so we give this package to the franchisees. They get a fully fitted out 500 square foot clinic, the training that they need, the equipment. We provide them with the operational support, and they operate the model in their communities. So in terms of our growth, we've spent the first number of years really, like I said, iterating on this nexus of cost, quality, and access, and then pivoting to the franchise business once we had the business format, kind of established. In the last year, we've acquired a chain of 5 franchise clinics. We've added 3 more. We've proven, profitability with the franchise clinics, and now we're ready to scale them. And so we're looking to first do that through batch scaling in 2021, and then grow much faster post 2022, and really start to have more cross-border growth outside of Kenya and in the continent in general.
Great. So how many franchises did AccessAfrika start with?
We started with 5 franchise clinics. We now have 8.
Oh, okay. 8 additional or 8 in total?
8 in total, yeah.
Okay. And what's your target for next 5 years like?
Well, so next year we want to double the size. In the next 5 years, we're looking at 186 sites.
186, is it? That's quite a big target.
It is, and this is also kind of starting our market expansion outside of Kenya. And here we're looking at, growing through master franchising. So taking, experts and entrepreneurs in other regions, training them on our model, and then delivering them in again, a more localized method in their locations.
Oh, yes. Okay, so that's quite a big target, and I'm sure there is a strong strategy backing to achieve this goal. So I'll bring my next set of questions to you with the context of the theme of the course for this week, which is co-creation and leveraging shared value. I'm sure that in achieving your next 5 years of target, you will need a lot of people, a lot of partners. So here is my next question to you, where we are looking at co-creation, which actually underscores the process of co-designing and implementing together. So AccessAfrika probably will require a lot of partners in the process, and you already may have had your experience of acquiring partners with a particular approach. Could you share your principles of co-creation, especially around leveraging shared value with partners?
Yeah. So one, I think, is really important is obviously for the organization. For us, in our case, is really understanding what our end goal looks like and what success looks like. So, for example, for our diabetes and hypertension program, this is a new program that we envisioned in about 2017, actually, with Boehringer Ingelheim as a co-creation project in the Making More Health And the primary driver for this, like I said, is for us is we're primary care providers. What can we provide under the umbrella of primary care? And diabetes and hypertension, chronic disease management in general was an area that we identified. So typically you won't find diabetes and hypertension embedded in a level 2, kind of facility in primary care. Patients often have to bypass that level of care and seek care in higher levels of care. So it means higher costs, travel, but just even the cost of services, but also a delay in accessing services. So this was our goal. Can we integrate non-communicable disease management within primary healthcare? Again, on this nexus of cost, quality, and access. So we'd really been focusing on, early curative care at the time, treatment for, prescriptions and treatment for illness. But we really wanted to have a more healthy, proactive approach to healthcare. And so that was the other primary driver. And really understanding how we can achieve this. So we started this co-creation project that was designed to do that, and it focused on awareness and screening, conversion to care, maintenance and care, and evaluation and outcomes. And so be able to triage and evaluate your performance, identify people who are not kind of doing well, and then charge those people to escalate their care to higher levels of care. So building a lot of access at the base, while efficiently triaging upward people who need care. So understanding, what our goal and success look like was really important to keep focus on all the possible opportunities that can arise out of, these kind of partnerships. And then also understanding the end goal of our partners. So for Butterfly Inc., Butterfly Inc. have developed a point of care ultrasound, which we started to use. And really for us, for a type of company like AccessAfrika, and AccessAfrika is a company that is growing, like I described, through our franchise. And we have this clinic in a box that has equipment and assets. Is essentially a distribution kind of channel for partners of equipment and other kinds of commodities through these clinics. So also understanding what the end goals of the partners are to establish this kind of shared value. And so they have a goal towards increasing access to ultrasound services for pregnant women, and in this time of COVID, even for COVID lung scans and things like that, through users who are non-technical. So you can have a community health worker, you can have a clinician use the device, or rather hold the device, and you can have a remote sonographer who takes, requests from various places. So you don't really need to have a sonographer in every area. So the importance of understanding the goal of the end partners then in shaping the partnership. And then another key one that I found is being able to negotiate around sub goals, because there are always other things that are additionally great to have, but can end up becoming very complex if you try to achieve everything. So I would underscore, you have your main goal and you have sub goals, some of which don't need to cover 100% of your needs. So you need to know where you're going to give a little, and then really understanding your competencies and strengths, right? Are we going to need, any short-term or long-term support to be able to do this? Is there a quicker way that we can achieve this? So, for example, our mDaktari platform is a platform on which, you can get virtual consults, and the various other building blocks that we can add value to our users. We can we can develop all of it, or we can partner with people who have already developed features and services that can be deployed on our platform. So really also knowing what your short-term and long-term needs are and what our strengths are today, and are there people who we could partner with to be able to get there faster, to have a better product, to have a faster growth, etc.
Great point, because I just took some notes and said that, yes, end goals and negotiating sub goals, it's so important. It's so important part of any harnessing any long-term I think a fruitful partnership. So I'm sure that these insights are very applicable for all our learners. There is also an infamous quote where we say, alone we can do so little, together we can do so much, but then we have to see what we want to do. So my next question to you is, what has been some of the most successful partnerships that you have harnessed, and how have you navigated through some hiccups in the process of co-creation?
Yeah, so I'll go back to the one that I mentioned. We created this integrated model for diabetes and hypertension. It was extremely successful, and a success here I'm defining by, we grew 10x in the last 4 years in our NCD care. So tremendous growth we can see that we've had over the last 4 years since we started to roll this out. We have reached over 50,000 people in terms of screening. 80% of people who screened positive for diabetes and hypertension were previously unaware of their status, so they didn't know their blood pressure was high. It was the first time they were getting a screening, and so it has had a huge impact. We've had growth in the number of people that we serve. Today we serve just over 3,500 diabetic and hypertensive patients in our locations. We have an 80% adherence to care rate, which I think is pretty good, and it's really a testament to the design of and the iterative design, because it does evolve. It's definitely not what we built in 2017. We've evolved it, but to an extent that it is what we're, as AccessAfrika, one of the assets that we're starting to build from a tech perspective. So we're taking this essentially and building a health CRM on top of it for diabetes and hypertensive care managed, but it's also transferable to other, kind of patient types. It tracks a patient from the first point of contact through to their outcomes. Is their blood pressure controlled? Is their blood sugar controlled? And helps the manager then navigate, patient care. So this has been extremely, I would say this had great traction where it's standardized. So starting from innovation, it's standardized, and we're now scaling it through our clinics while continuing to improve elements of it. And so, in terms of like the hiccups, I think, and especially when building digital ones, are digital solutions is one in the key challenges would be in the design. So these are digital tools that we started to use. We had to train community health workers on how to use these digital tools. They were very used to a very analog way of kind of doing kind of work. So there's a whole additional kind of almost parallel, just as intensive work around behavior change and change management that you kind of have to as you're thinking about the solution, maybe really need to kind of focus on how important is it going to be to towards the success of this, to also similarly invest in the change management or the behavior change that is going to be needed to be able to do that. So I think in the initial days, maybe not so strong, because we kind of developed the solution, and then sort to, okay, let's take it to our users now and get them to start using it. So that went through a number of changes, a lot of intensive kind of administration, oversight, making sure that things are moving. But I have to say, in the end, again, through this an iterative approach, started to resolve, and always, kind of improving our products to make them as user-friendly as possible. Our community health workers now are very comfortable with the use of technology. So that's kind of one example I would give there. Another I would give was more recent in our partnership, for ultrasonography using this teleguidance devices is, again, I think it actually kind of still parallels the same complexity or challenges of user kind of adoption. And initially we had, it's obviously a typical way of kind of approach to solving the problem, and so you have this behavior change that you have to from the clinician who previously was not involved in the ultrasound process. They referred a patient for sonography or really just that, and so now you're including them in the work, and you need to get trained in how to hold the scan, and so there's mixed kind of adoption there. The sonographer as well, in things like COVID and ultrasound scanning, have their own kind of perceptions about and ideas about how the technology should and should not be used. And so those are kind of, complexities that you kind of have to work through. So again, needing a lot of change management. We have, great operations lead in AccessAfrika who takes a very great approach to this, and I have to say then ends up with a really transformative kind of a process and solution. And so for both of those, we've had, like I said, great impact. We've had great access to care through ultrasound scanning for maternal and child health. For pregnant women, we've seen over 200% increase in uptake. Cost has gone down for the patient, so we have the lowest cost ultrasound that you could possibly get. So both barriers are really low. But getting through those initial hiccups is really the make or break.
Great that you mentioned telemedicine, because we've been hearing for almost last 2 years that telemedicine is on an upsurge, and especially with the pandemic. So actually, I have you actually touched upon two very important points. One is people management, not behavior change, and change management. So I have a question, but before that, I just wanted to ask you, as a healthcare provider, was there any change in the way you have been building partnership as post this pandemic?
Yeah, so I think, one is there was definitely a whole kind of like period, a hiatus that everybody went into after the pandemic, and fewer opportunities to kind of meet and kind of engage with people who are working on other solutions, and so one but we did see you're relying on your networks, your previous partnerships, and your previous that you've already established, and those networks to go. We did see a huge response from our network, from people like the Miller Center, that we've worked with before, Accelerators that we've been a part of before, really coming through and identifying kind of spaces, challenges that organizations were facing, and putting together opportunities for us to kind of address those. So this changed to more kind of just a virtual way of interacting, and we did still see a continuing of virtual accelerators happening, which was really interesting to see and do. And so we happen to be a part of that in this particular COVID period that we've been, which again has been useful because it opened up a lot of partnership opportunities, from financing to in other industry, healthcare industry players that might be offering complementary kind of services. One of the companies in our cohort develops masks for COVID, is developing vaccine testing kits, rapid testing kits, at an ultra low cost. So these are really important opportunities for us as a healthcare providers to be able to leverage. But one key challenge is being able to still access them at a point where things are kind of slowed, pace is kind of slowed down. But it's picking up. It's picking up, I would say.
Great. So healthcare innovation was also on an upsurge with the pandemic in the background, is it?
Yeah. Yes, it was. Yeah, absolutely. Absolutely. And, and I guess it is, in a way, it's also, great for for companies to really think about their resilience in times like that. Yes. And, for us, that's actually when we started to use mDaktari, our virtual clinic. And it actually just pushed us to it. It's something we've been talking about for some time, but it actually just pushed us to do it. And one of the things that we learned is we often thought that there'd be a user difficulty, a digital literacy challenge with our target users. But we found, we got people on with not as difficulty as we had initially anticipated. So sometimes your own kind of perceptions are the barriers, but when kind of pushed to do it, we were pleasantly surprised to see. Right now we have over 200 people in virtual groups, support groups that we were doing. Kind of physical support groups, multiple locations, and just have a virtual group now, which is obviously more efficient. And so also the design of it, while kind of creating continuity for patients, also inadvertently also created a more efficient way of operating.
Great. So Daphne, picking on your comment on behavior change, we know that people and teams are important in delivering any mission or target. So my next question to you is, building and being part of strong team is key to reaching big objectives. What are your recommendations for building strong teams?
Yeah, I guess this is also always a forever learning, kind of forever learning area. But the things that I guess struck out to me as kind of key things is one is finding a culture fit when you're during the hiring process. I find that, people have, there's obviously we live in a world where there's diverse, kind of opinions, approaches, and diversity is great. But it also needs to kind of fit within your vision and mission of the organization. Otherwise, it can create tensions that are based off of ideologies and kind of things that are harder to shift. And so I think culture fit is something that and obviously the question is, how do you establish culture fit? But this is something, again, that you continuously kind of, evolve on our talent kind of officers, something that she's always kind of thinking about, and we think about together on literally weekly culture meetings, so continuous investment in what that is, how are we demonstrating this, how do we inculcated from any interaction that we have with an individual, whether this in an application process or even if it's on exit. So really a focus on that, I think is quite strong. And then I think also the other thing that I've also come to realize in this kind of COVID pandemic and remote work is paying attention to the people who work really hard and need less supervision, just making sure they're okay and they're doing it, just checking on them, because you can assume that the hard workers, they need less oversight, they're doing it, but I think this is a group, and they say that now the world is going through is it called the Great Resignation, where the COVID pandemic is really making people reflect about their roles and their employment status and their opportunities and where they want to be. And there's a huge shift in companies kind of going on, and so just kind of honing in on building and strengthening teams, and especially now when COVID has brought an additional effects and thinking and people in their way of life, and just just substantial changes. So really just, honing in and thinking about your teams and how they are actually thinking through these changes that are happening. It is a completely different environment right now, and we need to keep up with how people are thinking, rather than making assumptions on how we should all move as a group. Because we obviously have very different kind of perceptions on these things. So paying attention to those kind of hard workers that are working under the radar, making sure that they're happy. And then I guess another key completely unrelated thing that I just more recently kind of was a learning aha moment for me is besides being unbiased to in a kind of in conflict, specifically, sometimes the person that or the individual around whom the conflict is centered might actually be the person who needs you as their cheerleader the most. And I'll give an example of an individual who might be working in a very kind of difficult, high stress environment, and their feedback from the rest of the team is, primarily on things that are not working. That constant, kind of feedback on what is not working can create a lot of conflict. But what I realized is actually what this person needs is not, even an unbiased opinion is not helpful. It's actually for me to be the cheerleader, and point out what is working, just point out small wins, and continuously do that. So just realizing your role sometimes in different things is important. So those are my kind of few observations on that.
Great observations, Daphne. Daphne, I must tell you that we've got more than 300 active learners on our course platform, and several of them are watching us live at the moment and have started sending lots of questions. So I need to take a few at the moment, and then I'll continue with some of the generic ones that I have for you. So one of the questions that comes straight from India, where I also come from India. So it's Tina Shubhamurthy. She asks, collaboration is helpful, but there is always a restriction of competitiveness, which ultimately can affect the goal. How can we reduce competition and focus on the final goals and its impacts?
So just making sure I understood the question correctly, is this asking about competition, external competition?
Could be both. She hasn't mentioned, but she has said that there are restrictions of competitiveness. It can be within, in a large organization if she's an entrepreneur, and it can be external. So she hasn't mentioned that. She's just generally mentioned.
Yeah. Well, I can give, I definitely agree that can be, the case if I've understood the question correctly. There are situations and partnerships where you might actually find yourself as competitors to with a different. And I think sometimes you just need to kind of make the call on, yes, this is, one of those situations. And sometimes there is an opportunity to have kind of additive. So it could be direct competition. And because a lot of the systems that we operate in are kind of value chain. So you might be focusing on one aspect of the value chain, your kind of partners that you're looking at are focusing on another, and either of you could go either way, in that value chain, maybe not now, but in future. And I think everybody is kind of still thinking about that, and in that way it can be considered. But I think if you have kind of defined as your kind of clear focus and strategy, and kind of sticking to that, then you can identify who would be the people who are complementary to that. So, for us is, we're not in the business of kind of supplying medication. So we're definitely not going to do that, and we're going to use partnerships to do that. There are gray areas that, kind of exist. There is others that can be complementary. So for example, like distribution, we have a clinic in a box. It has a certain number of assets in it. So those are partnerships that, yes, as we grow, can we negotiate partnerships that essentially this serves as a distribution kind of network that's adding value to our clinic in a box, to our patients that we serve, and is a kind of a distribution channel.
Great. I'm going to take another very interesting question that comes from Alina. And Alina is asking, what are the most important skills that we can bring in the healthcare innovation to improve well-being of our patients? And do you think, what do you think about including patients in the teams that find innovative solutions to real-life problems?
Yeah, that's such a great question. I think the skills that, I'll start with, the first thing that relates to your second question is human-centered design. I think those are definitely one of the kind of key skills that we need to have as kind of administrators in healthcare and innovators in healthcare. So human-centered design, which to your second part of your question is, really making sure that they work and they're useful to people. So bringing that voice in. I think systems thinking is also something that, again, can be quite transformational. So this is the, kind of, we solve a problem, and especially when we start out and there's actually no problem with that. It's a very focus of, this is the problem, here's our solution, and we implement our solution. But as you grow and start to become more established, obviously you're now start to think about the ecosystem within which you work, and there are barriers to you achieving those goals. So an example for us is, for example, health financing. 80% of Kenyans are not insured. So 99% of our patients are paying out of pocket, which means we need to be affordable. But, we're building a model in that regardless of who the payer is, whether it's a patient, whether it's a third-party insurance payer, whether it's a government, that it's affordable and gives you the highest kind of value for your dollar spent, right? In terms of the quality and the outcomes that you get from that care. In that ecosystem, we need health financing partners to continue to innovate with, right? People who are solving the, kind of the underwriting, the delivery of affordable insurance to the mass market, to the uninsured. You need the patients as well in terms of their awareness. They need to know where quality and affordable healthcare is. They need to know what it is. So you need people who are, kind of players in advocacy in that sense, to be able to kind of build up that side. So you need, institutional partners, as well, people like, doing research, for example. So that identification of other players in the market, I think, is like the next level of, kind of thinking about the solutions that we're working on today, is who are those ecosystem partners? How can we, which ones do we need, and how can we create a collaborative approach that solve a bigger amount of the problem and make larger strides towards that.
Great. And we've actually seen a lot of patient participations in diseases like cancer, where they offer non-medical support to each other, or to those who are impacted. So yeah, surely what you said made a lot of sense. We've got another very great question coming from Monica Toto, and she was asking, in any growth strategy, there will be risks. So how does AccessAfrika mitigate growth risks and make sure it remains focused on its initial mission?
Yeah. So I guess, it starts from, as first of all, the identification. So being really clear on what those risks are. And I think this is also something you don't want to do as an individual. You want to do it with your team. To really identify what are the key, risks. Are they financial? Are they I think, is it going to be quality? Is it going to be the competition, etc. And have, obviously once you've kind of identified them in a very collaborative way, and I just underscore that because it's obviously important to have a diversity of input in that. Also from industry experts, so people who have investors will typically, kind of help you identify where the risks are, and you can tell by the questions that they're asking you where they see the risks. So take good notes on those ones, and make sure you're addressing the answers to those. So not just from your team internally, but critical players, and I would say investors obviously being one of those. Those are the easiest people that you have access to because you're talking to them. But other people that you can identify to reliably kind of give you a kind of global perspective of what your macroeconomic view of what your risks are, and then obviously kind of really putting down deliberate efforts that you have today, how strong you think they are, and what which ones you can build on, and identify how you need to build them out. I hope that's helpful. But I think, regardless, they do exist, and obviously your goal is to kind of take a healthy amount of risks, but also to minimize them as much as possible.
In fact, I had a question that I wanted to ask a little before, but maybe it's the time for me to ask it. AccessAfrika has gone through a growth journey. Choosing right kind of partners to achieve different milestones in a journey, whether it's an entrepreneur or an intrapreneur, is very important. With AccessAfrika, do you think different partners or type of partnership during different phases of organizational growth was a strategy? Did you target a specific kind of partners?
Yeah, I would say at the different phases that we have been through, and we've been through, kind of several, we're now starting to grow. So in our early stage, it's very informal. So across people, you're even working with a group of people we're just kind of passionate about the kind of solution. And you wear many hats. You don't you perform several roles within the organization. It's very informal. From a financing, obviously you're looking at usually the people that you're immediately working with, your team of usually 2 to 3 people, and financing within those networks, and obviously with your operations now, especially when you're very small, very early, then you're focusing more on your community level kind of partnerships. So those kind of direct users of your product. So you're not looking at your any kind of corporate or institutional partners at that time. You're really, boots on the ground with the chief, for example, a local administrator, helping you find the right physical location to locate a clinic, the right people to talk to, making introductions within the community. So those are the partnerships that really matter in those early days. So the very direct and personal ones that you build, and your customers, you're also just acquiring them one at a time. Right. And then you start to build some science into it as you start to standardize it, higher levels of expertise. For us as Axosafia, we used a recruitment partner at this stage who had the tech, the systems, the know-how, and the pool of providers that we were looking for. So quickly outsourced that kind of piece of work, and so partnerships that we kind of built. Partnerships that start to bring on the expertise that you need, whether be it in form of business consultants or other kind of areas of expertise. So, people who can help you build, like I said, more of a scientific approach to your supply chain, to your operations, things like that, to your B2B sales strategy. So bringing a bit more strategic approach to the work. From financing, now you're looking at more, kind of formal funds, and starting to approach those because you have more kind of organized setup administratively and organizationally as well, and a semblance of that. And then obviously then in the growth phase, looking for much larger kind of partnerships across your legal and regulatory, your customers, financing as well. and obviously people, because you're growing at a large rate.
Great. I'm going to take one last question from the audience. And this is a question from Agnes Vidal, but also a lot of other learners from BI France. They have the same question. What are some of your indicators of success, and how do you measure the success of a clinic?
Yeah, well, we're tech-enabled primary care clinics, so we collect a lot of data. And so we measure things like our outcomes, so our patients feeling better, and all of our patients get a message 4 days after their visit asking them how they're doing, and this is really important for us to know that we've been effective in the care that we have provided, and provides us an opportunity to escalate care for people who might not yet be feeling better. And this is our role as primary healthcare providers, because as primary healthcare providers, we're meant to be the gatekeepers of the healthcare system. So keeping people healthy, identifying those who need higher levels of care, and passing them on to the higher level of care. So we measure outcomes in short. And we've maintained a 96% self-reported recovery for patients. And we have an escalation process to keep people in care or escalate them to the next level of care. We still follow up with those we refer out of the system as well to make sure they got the care that they needed. So it's really focused on the patient. So even if we referred you out, we'll follow up. Did you go and get that, CT scan? Did you see that cardiologist we sent you to, so it helps us also make the connections that we need for our patients in a very data-driven way. And then we measure our patient satisfaction as well. So this is measured from automated from our systems at each clinic, at each point of care, and reported on a clinic kind of basis. And lots more indicators to know how many female franchisees do we have, how many people have we served, diabetes and hypertension outcomes for, their blood pressure controlled and blood sugar controlled, adherence to care for maternal child health. But for us, for franchise clinics, as we're looking at them now, success is that they are sustainable, so they're profitable. The patients are happy, their net promoter scores are high, and their AFIA score, which is our quality, measures 152 indicators of quality. Their AFIA score is above 90%.
Great. Well, so many interesting insights, Daphne, but well, in interest of time, we have to wrap up. Thank you so much for sharing your lessons of wisdom, and I'm sure they have applicability for everyone who is listening to you, who is seeing this webinar, or will watch the recording. But before we sign off, I have one last question. What are some of the greatest lessons that you have learned in creating partnerships, and do you have any final words for our learners?
Yeah, the lessons are really in a kind of open, kind of minded approach to the partnerships, having very clear goals on what you want to do, but a very open mind on how to achieve it. And I think, really also kind of understanding what you can do and can't do in terms of complexities, especially when it comes to digital and tech kind of related challenges, because as an organization, I think it's really important to understand from a kind of cost perspective what complexities it could be adding to, the various integrations that you might need to make, the cost structure of kind of setting up different, environments for all these things. So really also thinking about how those are going to scale. So thinking about the complexities, leveraging your team in those particular areas to really weigh in early and avoid mistakes early on. So those are kind of three kind of top ones that immediately come to mind. But like I said, we've been lucky to have a series of really successful partnerships despite any kinds of challenges that I think have really kind of put us on this path that we're on today. And we're really, these are partners that we're continuing to partner with and grow, as well as increase the number of people that and opportunities to work with to broaden this, kind of combined and starting to have a more systemic approach to access to quality and affordable healthcare.
Great. And any last advice to our learners?
Yeah, I would say, use your networks, as much as possible. I think it's definitely have diverse, number of people and experiences to that you can reach out to people to ask for. So I would give you just, a few minutes of our experience, which is probably just, also just scraping the surface, but there's a lot more depth, there's a lot more information. So I think, that really, kind of learning from actual experiences could really make the whole experience for you a lot smoother, or at least give you a lot of insight kind of going in.
Thank you. Thank you very much, Daphne. Thank you for being with us today, and wish you all the best for successfully growing AccessAfrika and also reaching your 186 franchisee milestone. Thank you for being with us today.
Thank you. Thank you for the invitation. I was really happy to share everything we learned so far, and I'm happy to share more in future should there be a need.
Great. So thank you, everyone. We hope that you enjoyed today's session and will draw lessons that you can apply at your end. Before we conclude, one important announcement. We, Module 4 and 5 have assignments. Some of you have already started making submissions. We would recommend that all of you make early submissions so that you can receive feedback and also have the time to give some feedback to your peers. If you have any questions with regard to the submission or assignments, you can message us via the platform. Also, don't forget to block your calendar for the 5th webinar early next week on November 2nd at 9 a.m. EST, which we are going to have with Mark Sheng. And the webinar is focused on co-creation for idea development and pitching. So until we meet again, stay safe and enjoy your learning journey.